Now, again, good afternoon, everybody. I'm Sonja. I'm from WHO Regional Office for Europe. I work as a technical officer in the Non-Communicable Disease and Environment Unit. Physically, I'm based in Rome. I'm with the European Centre for Environment and Health because my original field of work is transport and health, but we do a lot of work on physical activity promotion and health. I'm very glad to be here. This is my first time of meeting this group after initial contacts we had with Jorma Savola. And I'm very pleased to be able to be here and to present to you some of the work and the approaches that WHO is doing in this area. I'm afraid I'll have to turn around a little bit from time to time, so you'll have to watch my back. I'm sorry about that. I was invited to speak a little bit about physical activity challenges and strategies to address them. So I'll start with an introduction on why physical activity is important. Of course, many of you will be very familiar with those figures that I'm going to present, so I'll be rather brief. I'll introduce you a little bit to the public health approaches that we at WHO take to promote physical activity, of course always including sport. I'll say something about the role of different sectors, again focusing on the sports sector. And then present to you the WHO policy framework in this field and some recent relevant publications, activities and programs, some of which you've already seen on the little table when you entered the room. Why is physical activity important? You probably know that in Europe, non-communicable diseases are the largest contributors to the burden of ill health. And you can see this illustrated in this graph, and you see here that this orange little figure is of a quite impressive size in Europe. Also, if you compare to other regions of the world, this is the American region, and this is Western Pacific. But also, if you compare to other causes like injuries or communicable diseases, this is a very important problem in Europe. Around 1/4 to 1/3, depending on how you measure physical inactivity of the population, does not reach the recommended levels of physical activity to maintain and improve health. The recommendation, as you're well aware, is at least 30 minutes of moderate physical activity on 5 days a week. More is better, of course, but this is the minimum recommendation that everybody should reach. This lack of physical activity leads to 600,000 deaths per year in Europe alone. This is about 5 to 10% of the total number of deaths per year. And over 5 million of disability-adjusted life years are lost due to this lack of physical activity. There's an unequal distribution with a higher burden in Central and Eastern Europe as compared to Western Europe. This is not only a health problem, but it is a problem for society at large, for example, having very important economic consequences. I'm not going into the details of the figures, but they'll be printed out for you. It's also interesting to note that, for example, in Switzerland it's been possible to estimate the savings that the current levels of physical activity already bring through saving of health costs, pain and suffering, of quite impressive figures that you can see there. Obesity and overweight is one of the most visible effects of a lack of physical inactivity, and unhealthy diets, of course, is also a very important risk factor. Obesity is not just a matter of aesthetics, as you would probably agree from this picture, but it is actually becoming, or some people would argue already is an epidemic. The prevalence in Europe is between 5 to 20% in men and up to 30% in women. This means that about 400 million adults in the region are overweight and 130 million are obese. These are enormous figures. And the trend is worsening, actually.
this is not only an adult problem, unfortunately. 1 in 5 children in Europe is overweight, and their number is increasing by about 400,000 children every year. Again, the trend is increasing quite dramatically. However, physical activity is much more than just obesity. As you know, physical activity has a link to many different health outcomes, among which overweight and obesity, but also other very important health outcomes like cardiovascular diseases, but also independence in old age, which is going to become more and more important as societies are aging. Mental health, stress tolerance, different types of cancers, etc. So let's not forget that physical activity goes beyond obesity and overweight. Now I'm going to introduce some public health approaches to physical activity promotion. Let me start by introducing a framework that many of you probably are familiar with, developed originally by Whitehead and Dahlgren, published in Lancet in 1991, which gives a very comprehensive framework of the different determinants that are important for health at large, but also for physical activity. So physical activity is not just an individual responsibility, even though individuals are of course at the heart of this framework, but there is a larger environment around that, obviously, the natural environment, built environment, the economic environment and the communities, values, social roles, etc. So there are a lot of different levels that we can work on. A very frequent approach to physical activity promotion, especially a few decades ago, would probably look like this, as a comic artist in Switzerland has shown. That somebody would go and tell people, do something for your fitness, don't just hang around all day. And then what usually happens is that people try to do a little bit, but it usually doesn't take them very far. Shown in a different way, there are interpersonal factors, as we've seen before in the framework, combining motivation, knowledge, and skills of people. And there is, of course, the societal and physical environment. And we can work with promotion on both levels. So the approach that we just saw would be to push people on the interpersonal level, to motivate them to increase their skills and to tell them to do something, while we don't change anything in the social or physical environment. As we've seen before, if you don't change the environment, so if the TV is still there, probably after, or also if the urban environments favor motorized transport and hinder walking and cycling, and these are pictures from Rome, but they could be taken in many other cities in Europe, probably, making walking and cycling virtually impossible, or at least very difficult. People stop after a while, and as one of the effects, get overweight, for example. So the other approach that WHO is very much investing in, and that has a lot to do also with sports for all concepts, of course, is to work on the social and physical environment. So to reduce the slope, to reduce the slope here, and make it easier for people to be physically active. On a population level, this very same approach looks like this. You always have a certain number of people that will move, no matter how hard you make it for them. And probably some of those people are in that room, the Danish colleague who's been walking here, and others. So no matter how difficult it is, some people will always be physically active. However, if we make it easier, if we improve the social and physical environment and make the healthy choice the easy choice, then suddenly a much larger part of the population is likely to become active. What is the role of different sectors in this concept? Of course, me coming from the health sector, and you coming from the sport and some maybe physical education fields, we have a key role to play. We're the key stewards in this area, and we have to take a leading role in fostering this field. But we cannot do it alone, unfortunately. You've seen that the scale of the problem is simply too big. We're speaking about millions and millions of people that we have to get moving across the region. So trying to do this solely working through schools, for example, will simply not solve the problem. So we have to work across sectors, and that's one of the reasons why I'm so happy to be here. Often also environmental approaches, as we've seen also before, are very important, but they're not controlled by the health or sports sector. They're controlled by the transport sector or by environmental sectors. So we need to build new partnerships and work across different sectors. To address this challenge is quite complex. It's very important that the solutions and options we're offering are equitable, because there is inequality in physical inactivity. There are population groups that have higher levels of inactivity, and that are those that have, for example, less money to pay for services or facilities. So we must make sure that the options that we are providing are not increasing this gap, because they're reaching those that are already active. And there are some approaches out there that go in that direction, and that worries me quite a lot, because we're actually making it worse instead of better. Also, while the sports sector is, the sport facilities are a very important part of the solution, we cannot solely depend on those, because we only reach one part of the population, but often not the most sedentary part, which is the part that we want to reach most. And here, for example, walking, cycling, or climbing stairs can be a very good approach, at least to get them a little bit more active and then take it from there. Solutions must be cost effective, of course. They must be easy for people, because we all know that it is hard for people to get started. So it must be enjoyable. This will increase the acceptance of all solutions that we propose. I'm not going to